Good afternoon. Welcome to the start of the 4th Viral Hepatitis Congress here in Frankfurt. It is my typical duty to introduce you to Frankfurt and to thank you to join us here. And then you will hear a little bit more about the meeting by my colleague, co-chairman Ira Jacobson, in a second. So with that, I just like to welcome you to Frankfurt, a city which was founded over 1,200 years ago in the year 784, first mentioned as a city. It was, of course, founded by the Roman everybody. It has a particular historic central part, but the attraction really is the kind of contrast you always have between old and new. Here you have the old opera house in front of one of the skyscrapers. We have no chance to compete with the United States and most part of Asia, but for European standard, there is really the only city in Europe which has what you could call a skyline, but we don't wish you to be at the River Main to have this view on the skyline. We rather appreciate if you go there at nighttime and you would have this view and you stay during the day at this meeting. We have a new kid on the block. You see it is a skyscraper which is a little bit a part of the lumping skyscrapers of the business banks, and this was built on purpose by the European Central Bank. It's roughly 1 kilometer apart from all the other skyscrapers, and this was just completed last year and is now the major office of Mr. Draghi for the European Central Bank. And you have read the newspapers, and it's probably quite a critical building currently within Europe, with a lot of debates on countries such as Greece. We had the meeting so far at 4 different venues. We started in 2012 in a building which has quite a historic background. It was the original headquarters of what was called in those days, when the building was created, the IG Farben, which was the major complex before the Second World War, consisting of Höchst, Bayer, BASF, and all those major pharmaceutical companies. And after the Second World War, it was the European Pentagon. It was for many years the headquarters for famous US generals, including Clay, Eisenhower, and Powell, who stayed in these buildings. And just recently, some 20 years ago, it became the new university building of the University of Frankfurt. In the next year, we moved to the Messe Frankfurt, to one of the 2 congress centers which are in this area of the town. And we are always in big competition with major exhibition fairs, in particular with the world's largest automobile exhibition, which will actually start again next week here in Frankfurt, in these buildings you see on the lower part. This is a meeting where we have more than 1 million people attending. It's really the world's largest automobile show, and we are trying to organize actually one of the national meetings here soon in the forthcoming years of our society. But it's virtually impossible because it takes Mercedes just 4 weeks after the meeting to deconstruct all what they build in these halls. So the whole place is occupied just by deconstructing for 4 weeks by just one simple automobile manufacturer. So that's big money what rules there. Last year we had to go to the airport of Frankfurt, and this is probably the largest skyscraper, but the architect felt that probably a 700-meter high building is not the best way to put it in a vertical way at an airport that could be misunderstood, in particular by terrorists, and therefore they put this skyscraper on a horizontal way, which from an engineer's perspective was probably even more difficult than to have it on a vertical axis, and they put it actually on top of the fast track station at Frankfurt Airport. And this year, I think we finally found the best place really to organize this meeting. That's the new Congress Center, which was just opened last year, actually opened by Angela Merkel. She is everywhere here in this country. She opened this last year. And since we have a government run in this city by the Conservatives and the Greens, we had to agree with the Green politician that this is kind of the most ecological Congress Center in Europe. It has no energy which is spent whatsoever, and it is so green that if you would deconstruct it, it could be completely recycled. But we stay here, I think, for the next years and not thinking of any recycling, but we are thinking of green movements and have therefore also created this meeting as a paperless meeting, so we can see those trees in the front of the building grow and not making them to paper. So welcome here in Frankfurt, and I'd like to hand over to Ira, who is introducing you a few special aspects of this year's meeting. Ira.
Thank you, Stefan. As you pointed out, this is the fourth Viral Hepatitis Congress, which we would like to think has become the Frankfurt meeting, and it's been my honor to co-chair this with Professor Zeuzem from the inception of this series of congresses. It's a portentous time in the history of hepatitis C especially, but not exclusively, as you'll see. And I want to give you a brief overview of our program for the next 2.5 days. First, we'd obviously like to thank our faculty for their continued support and welcome 2 junior scholars who received full support to attend this year's Congress. We welcome, of course, both new and returning participants. We encourage your feedback on this year's meeting, and more information on how you can do this will follow. We'd like to thank our scientific committee, which is critical to the formulation of our program and also extremely helpful and vital indeed in grading the numerous abstracts that are submitted to us. We have on the scientific community Professors Aftal, Craxi, Dusheko, Feld, Marcelin, Rockstro, Wiedemeyer, and Professor Foster. We began this Congress 4 years ago with the dream of it becoming a truly international venue, and I think there are actually 6 continents represented amongst the countries from which our attendees have come, or at least registered this year. I'm not sure every one of those 6 continents is yet represented in this room, but we hope that they will be by the end of the afternoon. People do tend to come in the course of the first day. In any event, we're delighted by the international representation represented by the attendees. We hope, as we believe we've succeeded in doing before, to provide the highest quality scientific program with the leading international thought experts in the field of hepatitis and liver disease. We're going to augment our didactic presentations, which are the core of the program, with many discussion sessions, and hope for lively interactions not only between the speakers themselves, but between the speakers and you, the audience. And we're going to critically assess the current landscape, debate the clinical practicalities, the difficult treatment or management decisions, and examine the challenges we still face with hard-to-treat patient populations, even though as far as we've come, there are still challenges remaining, and I think you're all familiar with those. We don't want to devote ourselves exclusively to hepatitis C. We've historically included hepatitis B and hepatitis D in our coverage, and this year we've added fatty liver disease as well, for the obvious reason that it's a critical international public health problem emerging ever more on a larger scale. This year, the scientific community has awarded 5 scientific posters of distinction. Please do take the time to look not only at these, but all the posters, of which there'll be many, right outside this room during the breaks in the program. This year's Congress will focus on a number of themes. First, and much more than in previous years, the expanding real-world experience with direct-acting antivirals for hepatitis C. Our keynote lecture by Dr. Nelson will emphasize this area in just a few moments. We're going to talk about new treatment options for hepatitis C that have emerged in the past year, including a regimen for genotype 3 that was approved first in Europe and then in the United States. We thought, as Professor Wiedemeyer said in his pre-Congress workshop talk just a little while ago, that ribavirin was dead and buried as of a year ago at AASLD 2014, but it's enjoying a resurrection. We'll talk about the data underlying that contention and talk about the controversy that still applies to the precise clinical settings in which ribavirin could still be used to good effect, much as we'd like not to have to use it. We'll talk about the increasingly effective treatment that are rendering our most challenging and hard-to-treat populations not quite as challenging or hard to treat as they used to be, perhaps exemplified best by HIV, HCV co-infected persons, but also patients with advanced liver disease and renal disease, amongst others. We'll talk about the very lively controversy right now and very impactful for those of our patients who are affected by decompensated cirrhosis, about the issue of whether the availability of effective treatment, which we have, necessarily means that all these patients should be treated, or whether there's a point of no return, as it's sometimes been called in the past few months since these data came out, where you might be better off deferring therapy, letting patients get transplanted, and then treated post-transplant, which can now be done effectively and safely. We'll talk about the emerging topic of DAA treatment failures, which is linked to the topic of resistance in the setting of DAA treatment failures, obviously post-treatment, but another lively controversy pertains to the question of whether and when we should test patients for baseline resistance to protease and or NS5A inhibitors, particularly because both of those are now commercially available in many of our areas. We'll talk to a greater extent than in the past on the complications of liver disease, because it's clear that despite the increasingly effective treatment options that we still are left dealing with these complications of advanced liver disease, and there are new things to talk about with regard to HCC, ascites, and thrombosis, and we'll have a talk on the management of diabetes and cirrhosis as well, a very prevalent topic. Talk about hepatitis B and D with regard to exciting recent scientific advances like the discovery of the receptor for hepatitis B, very long sought and a recent emergent finding. We'll talk about current treatment strategies, both short-term and long-term, and exciting new therapeutic horizons. And as I mentioned, we're going to devote some time at this Congress to non-alcoholic fatty liver disease and non-alcoholic steatohepatitis with regard to the epidemiology, clinical implications, the considerable challenges in the design and endpoints for clinical trials, much more complicated than a hepatitis C trial where the primary endpoint couldn't be more straightforward at the present time, SVR12. Very different. You really have to think about how long you need to conduct your trials, what the endpoints ought to be, what surrogate markers might be available. We'll have talks about that. And of course, new therapeutic approaches to fatty liver disease. In 2014, we made the switch, as Stefan mentioned, to digital interactions. In addition, all the Congress materials are now in a dedicated portal on the Congress website. We have a meeting app that can be downloaded. Instructions have been given, but if you need any help, please turn to any of the Congress staff around the room or in the back. The app will allow you to take part in our interactive polls, send us questions, and see all the up-to-date news emerging from the Congress and its talks. And all material will be available online with free access to webcasts, posters, and more. We encourage involvement from our online community, and we'll be tweeting throughout the Congress if you'd like to join the conversation. Make sure you follow us at VHC Frankfurt, and you can use the hashtag VHC Frankfurt. Our program today, after this official opening, will begin with Dr. David Nelson, who'll talk about HCV registries, and then, again, very important real-world issues like the differences between U.S. and EU labels, and also the society guidelines for hepatitis C regimens. There are many similarities, but some very interesting and important differences as well. We'll talk about this question of ribavirin, to which we alluded, and the ever-important question of drug-drug interactions with an international expert, Dr. Bach, and then we'll have a series of exciting oral presentations with original or recently emerged data that deal with some very important real-world questions about how to manage our patients. And then finally, we'll talk about the difficult-to-treat populations that I alluded to earlier. Again, each with speakers that have contributed importantly to the literature on those respective topics. So we want to involve you as much as possible. I can't emphasize that enough. There are 3 ways to ask a question. First, via the app, click on a session or presentation, and we think most of you will use email at vhcquestion@gmail.com. You're also welcome to use the standing microphones in the auditorium, or for those of you who can tweet better than I can, you can tweet us a question using the aforementioned hashtag VHCFrankfurt and follow us on Twitter at VHCFrankfurt. And of course, we'd like to thank our sponsors, including Janssen, Gilead, Bristol-Myers Squibb, AbbVie, Achillion, and Merck Sharp and Dome. Much gratitude to those companies for their critical support for this Congress. Finally, please ensure your mobile devices are set to silent. The meeting's been granted up to 11 CME credits, and to obtain those, please sign the register at the Congress registration desk on a daily basis.